Hi, I'm Colin Hung with Healthcare IT Today, and I'm excited to be sitting down with these two gentlemen to talk about rolling out a concierge approach at Akumin. I'm here with Cliff Dinwiddie, VP of Strategic Marketing at Windstream Enterprise, and Rohit Navani, COO and Executive Vice President at Akumin. Like I said, we're going to be talking and discussing the thoughtful concierge approach that Akumin is planning to roll out at their practice to the delight of patients and clinicians, and how the partnership with Windstream is making that possible. Gentlemen, welcome to the program.
Okay, thank you. Glad to be here.
Rohit, let's start with you. Can you maybe tell us a little bit more about this digital-first, patient-centered approach that you're really going to be pushing forward here at Akumin?
Yeah, absolutely. So when it comes to Akumin's journey, a little bit about Akumin. Akumin is in the healthcare space. Akumin provides diagnostic imaging in an outpatient environment. We have roughly about 150 plus clinics across the country, and we see roughly about 5,000 patients a day. And we started this journey in about 7 years ago, and always top of mind has been taking care of the patients.
Right.
So as we've gone through, what we've learned is healthcare is an industry that really is not patient focused. It's about the doctors, it's about the providers, but rarely about the patients, and it's about giving power and transparency back to the patients, which I guess we'll talk about as we continue.
And what's the sort of reasoning behind this transparency? You talked about that in terms of wanting to give patients the pricing and all these kinds of things. Why is that so important?
Yeah, if you take a look at it, right, healthcare is an industry that I believe really hasn't been transformed by technology. If you look at the world over, technology has driven transformations across every industry. But let's look at healthcare. What typically happens in healthcare, right? You start by picking up a phone.
Right.
Nowhere else do you pick up a phone anymore. You want to hail a cab, you want to book a hotel, you want to get on an airline, you want to cross a border, you don't talk to anyone, you could just scan your eyes and go. But in healthcare, you still pick up the phone to make an appointment. You still go to a clinic where somebody opens a glass door to greet you, hand you a clipboard. For Christ's sake, where do we use clipboards anymore, right? It's a very people-centric environment that really, I think, can benefit from the use of technology to give more power back to the patient. My business partner has this vision of a patient journey to really give transparency and power to the patient. And then that's very important for the patient because, again, as you look at healthcare, it's one of the only industries, if not the only one, where there is no transparency when it comes to pricing. You don't know what the cost of an MRI is. And when you go to a restaurant, you know that you're going to pay whatever the menu says. You know what you're going to pay for an airline ticket. But in healthcare, you don't know what that MRI is going to cost you. I might take $50 from you, but until the insurance adjudicates the claim,
right,
maybe another 50, maybe I overcharged you, right? So it's how do you solve those problems? How do you make the whole process more efficient by leveraging technology so that when the patient shows up to the clinic, you just go right in and get your scan done?
Now, everything you just spoke about, sort of, I'll call it healthcare traditions, the clipboard, the phone call, the glass door sliding through, there can be some resistance to changing that. I mean, we're comfortable in our status quo. When you're talking about this transparency, this patient-centric approach, has there been any resistance to it, or do you anticipate any resistance to this, and how might you overcome that?
Yeah, no, it's a good point. Because I have a theory as to why healthcare has lagged a little bit, right? And typically, most transactions are an A to B transaction. It's you and the restaurant, you and the airline. But in healthcare, you have you have your referring doctor, you have the insurance company,
right,
and us, the providers, right? So it's a four-way transaction, and not every party has the same vested interests, right?
Okay.
So as opposed to an A to B transaction, you now have four different parties. So resistance, the reason why I think it has lagged is because you can't get everybody to invest the proper resources to do what the patient really needs. And the question always becomes, who's going to pay for it, what the cost is, right? And so our theory really is by pushing this, by driving this, patients will take it on, and we can definitely provide it at a much lower cost to the patients.
Now, you've chosen to partner with Windstream. Why was that? Is there something that Windstream was able to provide you in order to enable you to achieve the patient journey that you're on?
As we looked at different providers, we settled on Windstream for a few reasons, right? One is, to me, it doesn't matter what business you're in or what you're buying or anything like that. What really matters is the people. If you can't get along with the people and you can't trust your partners in your time of need, it's just not going to work. So I think the primary driver, across all the different vendors that we met, what we liked about Windstream was the people that they brought to the table and the instant relationships that we're able to form. I think the other is the suite of product offerings. Windstream has the data, the network, and very importantly, the security. And I think the other also is price point, right? I think Windstream is very, very competitive. And then the final is stability. We've been very lucky. I mean, there's always outages. That's just nature of the beast. But Windstream has provided great stability for our business as well.
That's a great cue up for you, Cliff. Why was Windstream Enterprises so keen to work and help Akumin on their journey, and what did you learn through it?
Well, so I'd say a couple of things. First, what Rohit and the team at Akumin are doing is actually pretty revolutionary in this space. As Rohit indicated, not revolutionary in other spaces. We are all accustomed to ordering all of our services from the device, from our fingertips. And what we see happening here, we think is really important. It's a kind of a first mover advantage that this team has. We are thrilled to be on this journey with them. As Rohit indicated, we provide the underlying connectivity and all the access circuitry. But as you heard my friend indicate, that's not actually the solution that they need.
Okay.
There are any number of providers that can provide that circuitry. What we bring to the table is not only that underlying digital infrastructure, but the software that sits on top of that to allow my team and Rohit's team to actually see that network and make changes to that network in real time. Number two, I guess that would be. Number three, as Rohit indicated, the security blanket that you need to wrap around this whole thing. Remember, critically sensitive patient data and business data is wrapped up in this digital platform. The ability to protect that is absolutely critical. Rohit's brand reputation is at stake, as is mine. And in addition to the security, as Rohit indicated, we have this dedicated team of technology experts. We are a managed services provider, not a telecom, not a connectivity provider. We provide the connectivity and the managed services that are the solution that companies like Akumin and hundreds of others that we work with need. We're thrilled to be on this journey with Akumin.
And so it sounds like you're providing really that foundational layer and that's really enabling a lot of the change and the change management that you're talking about, Rohit.
Correct. Absolutely.
Yep.
Okay, so for someone who's watching this and wants to maybe go on a journey that you're on to become more patient-centered, to be more digital first, to be more transparent, what advice would you give them on how to get started and maybe some pitfalls to avoid?
Yeah, I mean, the first is hire me.
I like that one, Rohit. You're very good. That was awesome.
Yeah. No, that's just a joke. I think it has to start with a vision, right? So in terms of what is the value driver as to what you're trying to do, any business, right? Whether it's healthcare or anything like that. What's the value driver? Why are you trying to do it? What are you hoping to achieve? So I think the advice is really kind of focus on what the company wants to look like, where it is today, where it's headed, have that strategic rationale, and then kind of figure out how we're going to get there. For us, it was really about leveraging technology and driving change through technology, and our value driver really is the patient, right? And the how is leveraging the technology, using the backbone and the foundation and the security provided by Windstream.
Cliff, what advice would you give someone who's sort of beginning this journey?
Well, I have sort of an interesting answer to that question. My advice would be, don't take my advice.
Interesting.
My advice would be, all of the providers out there, they have the best group of advisors, and that is their patients. You heard Rohit, and I think you asked a question earlier about resistance to this digital transformation. Let me tell you who's not resistant. Patients are not resistant to this kind of digital transformation. My advice would be, number one, talk to your patients. They will tell you exactly where they want you to go. And the answers that you get from them are not going to be surprising, right? The answers that you get from customers, in this case patients in the healthcare industry, are no different than the answers that you will get from guests of the hospitality industry,
right,
and so on and so forth. They will tell you that this digital transformation is absolutely critical to their satisfaction, critical to the patient journey that you heard Rohit mention, critical to our ability to work together to execute on the quadruple aim, right? This is in addition to making this really good and scalable for patients. It also has got to be efficient for the clinicians and the people that are working at the practice. So my first advice is, don't take my advice, talk to your patients. Number two, as Rohit indicated, it is absolutely critical that you find a managed services provider.
Okay.
Expecting a healthcare provider to scale up a giant IT organization to support this kind of transformation, I submit, isn't reasonable. A managed service provider should, if you pick the right one, will act as an extension of your IT team, right? Act as your partner as you do what is a pretty big lift, going from that sort of old school from the 60s clipboard model that we were talking about a moment ago to where we're going now. That's a big lift. So find a managed services provider who will bring that connectivity and the software and the security, and to Rohit's point, the team. That team is absolutely critical. And you got to find someone who is going to be committed to this journey. A provider that will be so confident in their ability to deliver for you. Yes, with good pricing, but so confident in their ability to deliver that they actually guarantee your satisfaction, stability in price, uptime of the network, and your complete satisfaction. A provider like, wait for it, Windstream Enterprise.
Really? I would not have thought you would have said that.
I know. So that's my advice.
Awesome. Cliff, where can people go to find out more information about Windstream Enterprise?
Two places. First, windstreamenterprise.com. You will see all of our offerings and all of our managed service solutions. And two, if you're here at the HIMSS show, we are in booth 5851.
Awesome. And Rohit, where can people go to find out more information about Akumin?
Well, certainly we can visit our website at www.akumin.com, and that'll probably be the best place. Or you ask your providers or physicians about Akumin.
Amazing. Gentlemen, thank you so much for all the fantastic information and conversation today. I really enjoyed it. Really enjoyed learning about this journey that you're on, and congratulations again on this phenomenal growth that you're experiencing.
Thank you very much.
If you enjoyed this interview as much as I did, please like, subscribe, and mash that like button as much as you can on YouTube or wherever you're watching this. Also, head on over to healthcareitttoday.com for free resources and insightful articles. Plus, you can always connect with us on Twitter at the hashtag #HITSM. I'm Colin Hung. This has been Healthcare IT Today. Thanks for watching.